Doctors slash nurses slash redditors, what has been your most gory, disgusting or worst medical experience? As a paramedic, responded to a call of traffic accident, baby ejected. We prepared for the worst we could imagine. Arrive in about 8 minutes. Trooper on scene trying to clear the area of bystanders slash gawkers and preserve the scene. He had covered the baby with the yellow death sheet troopers carry in their trunks. Lifted the sheet to check vital slash pronounce death. And it was not a baby, but the top half of the 19-year-old girl that was driving the small pickup truck about 50 yards away. She was driving and arguing with her 19-year-old husband who was the passenger. They were doing about 55 miles per hour on a two-lane road and met an oncoming truck pulling a double-wide mobile home. She ran under the front corner of the mobile home, cutting her in half. Her bottom half remained in the driver's seat, while her unhurt husband watched as the truck skidded another 50 to 60 yards, sideswiping a minivan, sending it into the ditch upside down. When the truck came to rest, her bottom half fell out onto the ground. We also found a trail of ribs from the cab to the bed and down the pavement to the top half. It looked like a movie set. Her top and bottom looked unhurt, but from mid-chest to about pelvis was strung along the road. The husband was absolutely freaking out about what he had just seen. He was babbling incoherently, running around swinging at people, just a mess. A witness who lived right in front of the scene started having chest pains and had to be transported. We took the husband and I called medical control and actually got orders to give him IV Valium, something paramedics normally can only give for grand mal seizures. The driver of the big truck was fine, but was also very distraught at what he had just witnessed. That was 16 years ago, and I can still remember pulling up to that scene like it was yesterday. ERRN here. This, so far, is the only death I've experienced from work that I've lost a significant amount of sleep over. 24-year-old male walks into the ER with complaints of flu-like symptoms for the past 3 days. He had decided to come in that day because he started to develop a rash throughout his body that he was unfamiliar with. Sadly, this rash was actually the result of a failed battle with bacterial meningitis, causing him to bleed internally and externally. By the time we got him back into the ER, he started crying blood and the terror in his eyes was palpable. He went downhill fast. His lucidity diminished with his blood pressure, and the last thing he said before succumbing to pulseless VTach was something about his mother that we could not make out. You could see his consciousness fade from his eyes as we started compressions. The code lasted close to an hour. At first we could still keep his oxygen levels up with mechanical ventilation, defibrillation, and drugs, but blood was filling his airways faster than it could be suctioned out. He was bleeding too fast for any medications or fluids to keep his blood pressure up. He died soaked in blood and nearly unrecognizable due to his now almost uniformly purple skin and swollen face. We later found out that he was studying neurobiology, had a devoted girlfriend that was for all intents and purposes a fiancé, a large family, and many friends. He was an athlete who lived healthy. He had beautiful curly hair. This made the death tragic in a way that you just don't experience when a 80-plus-year-old dies. It made the unanswered pleas to God for help that had been sent echoing around the room by his family all the more bitter. I helped drag and push him into a body bag. In my EMT class, an instructor was telling me about one of her calls to a freeway accident. There were 2 cars involved, and one of them had an elderly couple in it. Since she was so small, my instructor is often assigned the job of crawling through the windows of the car to stabilize patients, while the crew works on prying the doors open. She crawled into the back seat of the elderly couple's car and held manual C-spine for the woman, holding someone's head in place to prevent an injury by twisting the spinal cord. As she held the head, it came off in her hands. The woman had been decapitated by the accident. She had to take a couple of weeks off after that and talk to a therapist to help cope. I can't imagine what it must have been like to go through something like that. A few years back, when I was a medical student, I was doing my primary care rotation when I had to see a morbidly obese lady for a gynecologic issue. She said she was having a lot of itching and soreness in her vagina. Even as I set up for a pelvic exam, I could already tell it wasn't gonna be good. I could smell a foul odor already, and I haven't even looked. I was gloving up when I got so nauseated, and I was about to get sick. So I excused myself and lied to my attending that I had a problem taking a look in her cause she was so obese and I didn't have much experience with such a challenge. The truth was I just couldn't stay in the room. It smelled like rotting vagina. A few minutes later my attending calls for me to show me what he found. I thought for sure it would be an aborted fetus, but I was wrong. I go in with my mask and there my attending dangles this cylindrical object covered with bloody debris. It was a ref king tampon. She apparently had difficulty removing it a week ago. My attending kept saying it stinks like a mag. The embarrassed patient was crying and I felt bad, but I had to step out of the room cause I was starting to regurgitate my saliva and was about to puke. To this day I can't forget that smell. It took a few weeks before I was able to go down on my girlfriend again. I think that was my deciding factor as far as not going into ob/gym. I just don't wanna encounter the rotting vagina smell again ever. A 70-something-year-old woman came into hospital with extreme abdominal/vaginal pains. So they first did a physical exam by pushing their fingers into her vagina to see if anything wasn't right inside. Well, as he pushed his fingers through, they stopped at a wall just a centimeter or two within. He was so confused to why the depth of her vagina was so small. The other two doctors also examined and were just as confused. They ended up doing an x-ray and it showed that her uterus was the size of a freaking basketball. It turns out that every period she's ever had has been stored in her uterus. They evidently had to cut it open, but when they did, 70 years worth of period blood came gushing out like explosive diarrhea. The room was filled with black-brown stale period blood and the smell was apparently incomprehensible. They spent a solid time throwing up after that. My sister's boyfriend is a nurse, and one day a very morbidly obese male was brought in because no one could figure what was causing his infections. Turns out his wife and him used to hide food in each other's rolls and the other would find it. His wife never found one of the cheese sandwiches he hid, and it got so moldy, and it was there for so long that it actually fused to his skin. One of the most horrifying things I have ever seen in the hospital was a guy who was on one of his prescription medications. One of the side effects was priapism, erection lasting more than 4 hours. Once the doctors got his cardiac and respiratory systems relatively stable, they tried to get rid of this poor dude's erection, which was starting to turn purple/black/blue. After several non-invasive methods, they did what they had to do. They had to inject drugs directly into the head of his penis. Not one shot, not 2, or 3, or 4, 19 injections into the head of his penis. It was still swollen, bruised and red 2 weeks later. I used to be a nurse's aide. I once had to put a very obese woman on the bedpan. She was only mid-40s, and I left. She put her call light on, and when I answered she said she was all done. I turned her on her side to remove the bedpan only to see that it is empty. My first thought was that she had been mistaken about having pooped. But then I look and realize that her ass cheeks were so massive, her entire dump couldn't make it the length of her cheeks and had gotten wedged in between them. I had to dig the entire load out of her ass by hand. It was only about 2 months into the job and it gave me some serious second thoughts, haha. Back when I was a nursing student I witnessed a very nasty procedure. A wheelchaired hobo who smelled because, well, who knows why, but he smelled like he hadn't showered in weeks, and he had a gangrene foot. Now I was still a student and I did not realize how disgusting an infected foot actually smelled like. My god, when the doctor removed the bandages covering his foot, it released this god-awful odor of just putridness. Combine the infected foot and the lack of a shower, ugh, and this wasn't the worst part. The hobo had a huge gaping hole in his heel and he needed some debridement. For the next 5 minutes, I witnessed the doctor physically go into the heel and scoop out dead cells and other nasty goop that was inside. Literally scooping out of his heel. It was like scooping ice cream, but instead of cookie dough it was scoops of combined dead skin cells, dried blood and who knows what. I did not witness this firsthand, but the most disgusting medical related story I've heard from a practitioner who actually lived to tell the tale. As part of my training to be a rape crisis counselor, a doctor came in to give a presentation about STDs and STIs. Somehow he veered off the main topic and starts telling us about the things he's seen in his time. a female patient came in complaining of extreme abdominal pains. The patient disclosed that she was a prostitute. The patient further disclosed that, in order to continue working while she was on her period, she would put a sponge as close to her cervix as possible to absorb the blood and other menstrual related discharge. The patient then explained that she had inserted a sponge and was unable to remove it. The doctor figured it would be a routine matter of removing a foreign object that had become lodged or stuck and takes the patient into an exam room to perform the extraction. When the doctor went to remove the sponge, it turns out that the patient had been using a car washing sponge to absorb her menstrual discharge, and that the same sponge had been in her vagina for 3 months. When the doctor finally managed to remove the car sponge, which had turned into black, semi-solidified mass due to excess absorption of nastiness, it also released a torrent of fluids that had been marinating in this woman's vagina for 3 months, and the fluids gushed out and nearly covered the entire floor of the exam room. The doctor told us that it was the first time in his 20+ years of practice that he actually vomited while performing a medical procedure, and that the stench from that room was so foul and pungent that it filled the entire clinic and made a seasoned nurse who was standing in the hallway vomit. As the doctor was retelling this horrifying life tragedy that he survived, he didn't look a single person in the eye. His eyes were transfixed on some non-existent point near the horizon of his traumatized memory. I was assisting in a crash C-section once. The mother was eclamptic, sky-high blood pressure, and the only cure is to deliver the baby. But she was only 25 weeks. It was so fast that there was no time to get an epidural, so we had to put her under general anesthesia. The baby had a strong and healthy heartbeat, but of course, once you deliver at 25 weeks, that doesn't matter. The father sat in recovery beside his wife's stretcher, holding their dying baby. The whole time tears and tears just running down his face. He never said anything. He just sat, without talking, holding a tiny bundle of blankets, looking down at a perfectly formed tiny face struggling to breathe. The mother was still sedated, but when I walked in, the father had the bundle in one arm and was holding the hand of the mother with his other hand. He was humming a lullaby. He just held the baby until he died in his arms, never saying a word. Just rocking it back and forth, humming to him, crying the whole time.